All right, well, good afternoon and welcome to the Vermont Medical Society U.S. House Candidate Healthcare Policy Forum. My name is Ryan Sexton. I'm ED physician at NVRH and President-Elect of the Vermont Medical Society. On behalf of our members, I want to thank the candidates who have taken time out of their busy campaign schedule to participate in the only health policy forum we know of leading up to Vermont's primary elections on Tuesday, August 9th. Each Democratic and Republican candidate running for the U.S. House seat was invited, and all of them have agreed to take part, except, unfortunately, Becca Balint had to cancel at the last minute. In terms of the format of today's event, I will start by giving each candidate a brief intro, after which each candidate will have the opportunity to answer 3 questions on healthcare policy. Each candidate has received these questions ahead of time and will be given 2 minutes to answer each question. I will ask 1 question at a time of each candidate, and we'll be using a timer that will be seen by all. When the 2 minutes are up, we will let the candidates know and move to the next candidate. And since we have limited time, we know that you will respect the time limits. I do urge VMS members that have questions for the candidates to put them in the chat. If there's any remaining time after our 3 primary questions, we will give each candidate 30 seconds to answer any extra questions. And if we don't get your questions, just know we will send them to the candidates that move on to the general election, and we will publish the answers in the next issue of the Green Mountain Physician. And so with that, I'll start with candidate intros. Sianay Chase Clifford is a Democratic candidate, a former aide to U.S. Representative Anya Tynio of Massachusetts. Grew up in Essex, Vermont. She also worked in the office of former governor of Massachusetts, Patrick Duvall. Molly Gray, Democratic candidate, served 1 term as Vermont's lieutenant governor and grew up in Newbury, Vermont. She interned for Senator Patrick Leahy, worked for Representative Peter Welch, and later went on to work for the International Committee of the Red Cross. Meyers, MD, Democratic candidate, is a physician who lives in Rutland and practices as a hospitalist at Rutland Regional Medical Center. Madden, Republican candidate, is a former United States Marine and veteran of the Iraq War. He now lives in Bellows Falls with his wife and young son and works in renewable energy. Ericka Reddic, Republican candidate, is an accountant, and she hosts a podcast. She grew up in Milton and currently lives in Burlington. And finally, Anya Tynio is a Republican candidate, works in operations and employee management in West Charleston. So let's jump right into our questions. Our first question for our candidates: what should Vermont physicians and healthcare professionals know about why you are running for Congress?
Great, I think I start. So I will jump in. It's great to be here with you all. I mean, we're pretty far into the race here, and we repeat our bios over and over again. So I'll focus more on a story. This was noted in my intro. I worked for Congresswoman Ayanna Pressley, and I was the health policy staffer in her office. And so, in addition to writing a lot of health policy legislation, apologies, there's a dog here too, so sorry for the noise. In addition to writing health policy legislation, one of the big parts of the job is talking to constituents. And so about, in an average week, I'd probably have about 10 constituent conversations with advocacy groups, et cetera, about specific health policy issues. And each of those advocacy groups would have about 3 bills that they'd want us to support that would each focus on a different problem within our healthcare system. And multiply that by weeks and months, I have this whole pile of legislation that folks didn't want us to support to address these little tiny things in our healthcare system. And when you take that as a whole, the only conclusion I think you can have is that we need systemic reform. By the time we Band-Aid throughout our medical system, we would be at a place where we need systemic reform. So that's why I'm running for Congress. That is what I saw. I'm so sorry. It's very distracting. That's what I saw. as a staffer. And we also, and I'll end by saying we saw that we can get politically impossible things done. Because of the pandemic, there weren't those political excuses. We were able to get pieces of universal care. We were able to see the type of social policy that we've been begging for decades. So we know the political capacity is there. We just need folks who are willing to bring that energy all of the time, who are willing to shirk the status quo and who are willing to be truly different and not maintain a politics as usual structure. So I'll pause here. I'm going to take care of this dog. Thank you. And I'm really excited to answer these questions.
We're moving on to Molly Gray now. Go ahead.
Good afternoon, Vermont Medical Society. Jill, Stephanie, Ryan, and Jessa, thank you so much for bringing us all together. And thanks to everyone tuning in from across the state. A little bit about me that I'd like to add to the bio, just by way of background in terms of experience. I spent about a half decade working in Congress for both Congressman Welch, helping to set up his office. I know his office was always a friend of Vermont Medical Society, and you can count on that from me if elected, but also working for the International Committee of the Red Cross and Congressional Affairs, supporting all of their work on Capitol Hill, particularly compliance with the Geneva Conventions and working on humanitarian action. I've also served as an assistant attorney general and a law clerk on the Second Circuit Court of Appeals to Vermont's Judge Peter W. Hall. And as lieutenant governor, have very greatly enjoyed the relationship with the Vermont Medical Society. As lieutenant governor, I've traveled across the state, visiting our hospitals, meeting with our doctors, and making recommendations to the legislature on how to invest here in the state. But what I know, and my reason for running for Congress, is that our tax base is small. The big investments that we really want to make in the state really require federal support, from expanding Medicare, reforming Medicaid, to ensuring that Vermonters have access to telehealth, supporting our rural health clinics, addressing our opioid crisis, ensuring that we have quality access to reproductive and maternal health care in the state. So for me, that's the why. I know I can be deeply effective in Congress. I know Vermont well. I have a strong legal background, and I think it's a good moment to have lawyers who are ready to uphold and protect the Constitution in Congress. So look forward to today's conversation, and many thanks again for the opportunity. I'm really glad that we're having a healthcare focused forum.
Great. Moving on now to Lewis Meyers.
Thank you. We've had about 8 forums, the candidates, so we've gotten to know each other a bit. This is the one I had circled in red for weeks or months now, because I am a physician and all of you are my colleagues. I went to George Washington University Medical School in DC. I graduated in '93, did my internal medicine residency there, finished in '96. And immediately went into primary care in both the traditional and practice, which was inpatient, outpatient, for 16 years. 14 of those I had my own practice, which I really, really enjoyed. And during that time, I was clinical faculty at GW, constantly precepting both medical students and physician assistant, or soon to be physician associates. GW happens to have a very strong PA program. I came to Vermont in the fall of 2012, and I've been working as a hospital physician for several months at Central Vermont, and then for the last 9.5 years at Rutland Regional. So I know healthcare on both a systemic and a granular level. I know how good we can be when we are allowed to be good. I know the kind of care we can give our patients, but I also know so many of the impediments that are put in the way of both of our patients and of us as providers now. And I think healthcare would be my focus in Washington. Obviously, there are many, many other issues, but it's the one where I would want to hit the ground running. And I think we can make some changes. I would probably differ a little bit with Ms. Chase Clifford. I think the possibility of systemic reforms are slight. I don't see Joe Manchin, for example, voting for Medicare for all, or even some of the Democrats currently in the Senate or Congress. But I think we can make changes short of that impact people's lives. I would also note that much of the press on this election has focused on the 2 professional politicians, Ms. Balint and Ms. Gray. I think that they have maybe overlooked the fact that there are 17 members, physicians. Oh, sorry.
All right, we're moving on now to Liam Madden. Sorry about that.
Hi, Vermont Medical Society, fellow Vermonters. My name is Liam Madden. I am a Marine Corps veteran who became the leader of the nation's largest anti-war organization of Iraq veterans. And why I'm running is as a renewable energy professional and the co-winner of MIT's Solve Award for Sustainability Innovations. I am deeply concerned that no one from either party is even acknowledging this fact. Our economy is completely dependent on energy. And if the economy grows at just 3% a year, we will use the same amount of energy in the next 3 decades as we have in the last 10,000 years. And that is impossible. And all the solar panels in the world won't make it possible. The other candidates and the parties they represent are not talking about the most glaring fact that we face as a civilization. Green New Deal or not, our economic system is not compatible with the basic reality of our resource limits. And appropriately responding to this fact would entail a scale of change that is not something our current two-party system is even talking about, never mind capable of delivering. The Green New Deal, as it is manifested by the Democratic Party, is a dangerous and hollow illusion of an adequate response. And what we need is profound structural change to both politics and economics, and that is what I will help us achieve as Vermont's representative in Congress. And we can only solve any problem we care about, whether that's reproductive rights for you or healthcare or building an economy centered around human well-being. We can only do it if we have a government actually able to solve our enormously complex challenges. And we can all see that our ability to solve collective problems is deeply undermined by many aspects of the two-party system. And my website explains multiple realistic policy outlines to liberate ourselves from the grip of its gridlock and corruption and reclaim the power we as citizens must hold to have a meaningful say in choosing our future. And it starts by electing credible independents with a vision for government that can both acknowledge and solve root cause problems. Thank you.
Thank you. Moving on to Ericka Reddic now.
Ryan, would you do everyone a favor and just repeat the question, please?
Absolutely. So what should Vermont physicians and healthcare professionals know about why you are running for Congress?
Okay, I love this question. The main reason what I would like everyone to know about why I'm running for Congress is because I have been in your shoes. I have been in your shoes. I have been in your patients' shoes. I have been in the shoes of the people that you're fighting for. Nobody has ever heard of this before, but I'm allergic to meat. Okay. So there's a tick. If you get bit by, you get allergic to meat instead of Lyme disease. And I spent 7 years going from doctor to doctor, doing every single test I was told to do. And no one could tell me what was wrong with me. And we went broke. We couldn't afford insurance. I lost my affordable health care after the Affordable Care Act was passed. My family has seen and felt what it looks like for our country to be running a sick care model and not a healthcare model. And I had a doctor who was honest with me and said, you know, Ericka, we can't really tell you what's wrong. All we can do is figure out what's not wrong. And so I understand what it looks like to face medical bills. I understand what it looks like to get sicker and sicker and sicker and have no one be able to tell you what is wrong. And I pray for all of the families who go through that. And so what I will do as Vermont's next Congresswoman, what you can count on as nurses, physicians, administrators, is that when I go to Washington, I'm going to really dig into the facts. I'm going to really look for positive solutions that make healthcare easier to access and more affordable. We need to make sure that doctors have what they need to be doctors, that we're not allowing regulatory burdens to get in the way of you all actually practicing medicine and taking care of your patients the way that you need to. Additionally, I only have 2 seconds left. Oh gosh, I hope I'll get to talk about it later. Thank you.
Thank you. Moving on to Anya Tynio.
Hello, and thank you for having me, and thank you to the participants for being engaged in this process with us. I come from a family of medical background. My grandfather was a pharmacist, my uncle is an internist, my mother is a psychologist, and everyone else nurses. So I really do have a medical care background, and I feel that I'm part of the medical care community just based on my family and growing up with the conversations I heard about how your lives work and so forth, et cetera. And I have immense respect for you and your profession. What I would say, I'm going to expand on my background just a hair so that this next thing that I'm going to say makes sense. I serve as the Orleans County Committee woman to the Vermont GOP, and I was elected to sit on the Vermont GOP Platform Committee this past spring. During that time, based on my conversations with healthcare providers in my family and without, I crafted, developed, and advocated for conscience protections for healthcare providers. And I will tell you, I did not realize that you had that much opposition out there. I was very surprised by it within committee, but overcoming those obstacles, we do have that passed in the Vermont GOP platform today. And that is something that I want you to know about why I'm running for office. I will advocate for all of you. I will listen to your concerns. I will take that to Washington, D.C., and I will advocate and legislate in your best interest. There was a question asked of me in committee why I was doing this when the Vermont medical group was not a very large voting bloc. And my answer to that is I care about everyone, and I do. And I will advocate on everyone's behalf and in their best interest. I look forward to this conversation, and I want to hear what it is that you need so that I can effectively face those challenges for you. You're the expert in your field, and this is what I do. And so you tell me what you need, and I'll help you. Thank you.
And we'll move on now, thank you, to our second question. In absence of movement on major healthcare reform in Congress, what are your short-term goals for improving access and affordability in our healthcare system?
Our healthcare crisis was not built overnight, and I have no illusions that it will be dissolved overnight and we will fix all of healthcare overnight. But that also means we still have to do the hard thing of moving towards an entirely public healthcare system. And I think that has to start with stopping the privatization of Medicare. I see that Dr. Malik is in the chat too, and I want to talk about what he's been addressing here in this direct contracting model, which is funneling folks into Medicare Advantage-like plans without their knowledge and without their consent. And it's really aimed at surreptitiously getting everyone into a privatized Medicare plan. You know, that erodes quality of care and it drives up costs. And also we know that these insurers, both Medicaid Advantage and these direct contracting models, also use risk adjustment gaming to further drive up costs. And again, are really not looking out for the best impacts for outcomes for patients, but are really just trying to figure out how to make the most money out of a very complicated, obfuscated system that patients don't have a ton of clarity on. So that has to be our first step. And two other things I want to address in this short amount of time is medical debt. We have to address why healthcare costs so much. But we also know right now, akin to our student debt crisis, there's folks who are carrying such a large burden of medical debt. And there's been some interesting proposals by the National Consumer Law Center that would get folks into automatic payment plans, especially if they hit a certain income threshold, and making sure that those payments don't extend over 5% of folks' monthly income, instead of handing folks with this incredibly large bill and saying, good luck, and we'll call you from a collector in a couple months if you're not able to make it done. And then lastly, we have to put out-of-pocket spending limits on Medicare recipients. Got it all in.
Great. I believe I'm next. I think first things first, we need to do everything we can next year to ensure, especially if Republicans take back the House, that we're protecting the Affordable Care Act. Second, we need to do all we can to expand Medicare coverage to include dental, vision, hearing. We know that's particularly important here in Vermont, as we do have an aging population with acute needs. Third, when it comes to prescription drug costs, ensuring that the government, Medicare, can negotiate fully, trying to bring down the costs that Vermonters are experiencing in particular every single day, especially as we see inflationary costs rise. Fourth, telehealth and broadband. Until every Vermonter has access to telehealth, we're not going to see equitable access in accessing it, and also making sure that it's fully covered through private insurance plans, Medicare, or Medicaid. So both the utility of getting it out there, broadband, and then ensuring that it's covered by policies. There were 2 questions in the chat I do want to address really briefly on Medicaid, making sure that we're expanding coverage as much as possible, and ensuring physicians are receiving proper reimbursement rates so that care can be accessed throughout the state. And then we know we can do that through federal support. And then finally, on the question around mental health care parity and access, ensuring that there's full enforcement around parity, not only in Vermont, but nationwide, and that individuals, small businesses, and those on any private insurance plans have full care and coverage. I'll stop there.
Wow, that was very quick. Okay, moving on to Lewis Meyers. You're muted, Doctor.
Can you hear me? Good. I don't have a timer either on my screen. So, but I do want to finish my thought from a moment ago. There are 17 members of Congress who are physicians, 4 in the Senate, 13 in the House. Most of them are doing really good work on the healthcare system. You don't have to be an attorney to serve well in Congress. And those would be my colleagues there as well. And I would certainly want to work with them on the healthcare reforms that we need. Short term, some of the things that we know as physicians, surprise billing last year was legislation was passed to, for the most part, end that. I think that's going to help hundreds of thousands of patients. We all know that observation versus admission in the hospital setting is ridiculous, and I think it should be ended. Again, it hurts probably millions of vulnerable people who come in the hospital and then can't get their subacute care covered or their hospital bills simply because they were deemed to be observation. On a broader stance, we need to work on antitrust. The big corporations and the private equity companies are taking over medicine. We see it here in Vermont. We see it across the country. They are going to come after the physicians. They're already starting to limit the autonomy of physicians. They're making us basically practice algorithm-driven medicine. They're making us spend over 50% of our time, both in the office and at home, in front of computers. We can do better, and we must do better. I hope the Biden administration will be stronger on looking at antitrust in the healthcare system as they have already in the IT. And one of my big focuses in conjunction with that is to build back independent practices in hospitals. 30 years ago, they were the mainstay of our healthcare system. I think they can be again. I think independents provide wonderful care at a much lower cost than the large corporate entities. Thank you.
Great. Moving on to Liam Madden.
I'll just start by saying I really respect both Molly and Lewis's perspective on this, but I'll start with my most practical ideas and then get a little bit more visionary than I think they got. The first out of the gate thing is I would work to pass the Prescription Drug Price Relief Act, which makes it so Americans don't pay twice as much for medications as Canadians. Realistically, though, I think we all know reducing prescription drug costs would only have a modest effect on the overall picture. So we could, how can we get more to the heart of the matter? And Lewis alluded to breaking monopolies. And I see one way to do that is to dramatically incentivize employee ownership and democratically managed enterprises. And in healthcare, that opens the door for medical professionals like you to feel safe taking the risk to run your own practices and making some room for more choice in this so-called marketplace. Complementing that, what if the government subsidized medical school costs for people who work in these clinics in exchange for treating economically vulnerable populations? And my more holistic response is that when it comes to lowering healthcare costs, the number one thing that lowers costs is prevention. And it's worth a pound of cure, right? I don't just mean preventative care, which offers little, if any, savings, according to the research I've seen. I mean preventative lifestyles. So this means we should invest in the community infrastructure, the education, and the incentives that promote lifestyles that keep us out of hospitals and to keep us moving in our bodies and eating more plants and less industrial processed foods and having more meaningful relationships, because I see these as the pillars of health. And if we focus more on health, we will pay less for healthcare, whether that's achieved through funding more community dance or sports or community organizations that are already doing this work. I'm confident we can get to the how if we can agree that the what is healthier lifestyles, which require investment not just in education and healthcare, but also in community.
Excellent timing. Moving on to Ericka Reddic.
So some short-term goals, and I don't think we even necessarily need major changes in healthcare reform. A couple things I would like to see immediately. Oh my gosh, forgive me. The End Nurse Abuse Act. I know that's the wrong name for it, but we need to make sure that the people who take care of us and keep us well are also safe and protected. So I'm a strong proponent of the End Nurse Abuse Act. Forgive me for getting that wrong, you guys. But I think that is something that is really important, and that's not major reform. That's something that most Americans can agree on. The most important thing we need to address is staffing issues. What my understanding from talking to particularly the administrators at Castleton, not only can they not find staff to educate the next generation of doctors and nurses, we're not seeing people go into nursing and healthcare in general. So we need to take a look at what it is that's causing people either to leave early or unwilling to go into the field to begin with. So I think something as important as this to our well-being as a nation, that is something that we should be encouraging as the federal government, as state governments, giving opportunities and providing people the opportunity to go be educated so that we can have the healthcare professionals that we need. I think one of the things that has made me the most sad and most disappointed as I talk to people is that you folks just do not have the care and the support that you need. So I would support more mental health opportunities and access for healthcare workers to make sure they don't get burned out taking care of their patients.
Okay, thank you. Moving on to Anya Tynio.
Thank you. I believe the question is directed towards access and affordability. Am I correct? Thank you.
That's correct.
So for affordability, I'll address that first. I believe that we need to move into privatized health insurance through employment and purchase plans. The government pays exceedingly less money to the hospitals and providers. So Medicare for all would hurt the healthcare profession greatly. And we need to, for access, we need to address staffing issues and to recruit doctors and nurses to come to our state based upon low cost of living, lifestyle, things that they would want for their children, good schools, rural life, whatever it is that attracts them. We need to, I disagree that we need to move to Medicare for all. And to do so, the government cannot afford to do that. American taxpayers cannot afford to do that. And we need to encourage more employment and employer-provided healthcare options to increase affordability for the consumer. We need to have multiple competitions between insurance companies. We need to help that to thrive because competition drives rates down. And that would be a focus that I have to move in that direction. I believe that America has the best healthcare in the world currently. We've all traveled. We know what it looks like in other countries, and I appreciate the standard that we have, and I wish to uphold that completely. We have hospitals around the state. I live in a very rural community, and yet I have access to a hospital. The only issue that we face is making sure that hospital is staffed and well-funded so that they can continue to provide support to their community. And that's a focus. And I'm very grateful for my local hospital. They saved my mother's life when she had a very, very serious health emergency. And without them, she probably wouldn't still be here. So we need to help rural medical care to thrive as well.
Thank you. We'll move on, and this is a bit of a shift. What are your, this is our third question, top public health priorities? So public health priorities.
Well, we know that health policy doesn't exist in a vacuum. And as a social worker, I think a lot about the social determinants of health and thinking about, when thinking about our COVID-19 response, although there was, we saw pieces of universal care, we know that we had so many gaps because we haven't addressed racism in our public health system. We haven't addressed economic justice or economic injustice. And we have severe fractures in trust in our public health system. So I think that's where we need to focus. We need to think about how do we build trust in our health system and make sure folks who have been historically exploited or historically experimented on or historically, ignored by our medical system feel that safety and feel like they are a whole person when they enter into the medical system. When we think about our maternal health disparities and why particularly Indigenous and Black women face much higher maternal morbidity and maternal mortality, that's going to impact how they interact with the medical system, whether they're pregnant or whether they're just going in for standard care. So that has to be, I think, our focus in moving forward in our public health system. And also we have to think about planning, and we have to invest in emergency preparedness in our public health system as we think about, what's happening right now with monkeypox. How do we make sure we avoid some of the missteps we made when addressing COVID-19? And how do we invest in a preparedness system so that folks are safe and that we can build that trust early and often, so that folks know that the information that they're getting from the government is as accurate and as safe as possible, and folks know what to do, and we don't have to go into this, I think, a moment of real fear and trauma. So I think that's where we can start.
Great. Moving on to Molly Gray.
It's hard to pick one public health issue, and I made a list as I was preparing for today, and I'm going to go through all of them because I frankly think that they all deserve a lot of attention right now and are pretty intersectional. First, obviously, we believe we're coming out of COVID and entering that endemic stage, but there's still a lot that we don't know about this pandemic or pandemic response, or a lot that we've learned and haven't captured. So I believe a strong public health focus moving forward has to be on preventing pandemics, on focusing on the NIH, and making sure that we're leading with data and science as we prepare for the future. Second, we can't talk about public health right now without talking about our prolific workforce crisis. A top priority of mine, if elected, is supporting our nurses, our physicians, our med students, our residents in going into the fields where we absolutely need quality access to care. That also includes retention and making sure that costs of living and increased costs of providing care in rural communities is accounted for. Third, gun violence is a public health crisis. And we know right now we need to make reforms as quickly as possible, be it safe storage or background checks, working to get weapons of war off of our streets, high capacity magazines. In Vermont, our mental health crisis amongst young people has been particularly prolific. I don't have to tell the ER docs on this call that, but making sure that we're investing in outpatient care so that the ERs aren't the place where young people are getting care. Our overdose epidemic in the state is also prolific. So investing in wraparound services, a lot of the programs here in the state we know are proven to work, but demand and require federal support. And finally, we can't talk about public health right now without talking about the Dobbs decision. I know there was a question in the chat, and access to reproductive care across this country. I will be putting my law degree into use immediately to ensure that we codify reproductive care and access to contraceptives.
Okay, thank you. Moving on to Lewis Meyers.
Thank you. I would echo many of the issues that the other folks have already highlighted. I would also add shockingly high maternal mortality in this country, more than other Western or developed countries. Also the increasing obesity epidemic, which leads to diabetes, heart disease, cancer. And then of course, all of the mental health crises, the gun violence, et cetera. I'm going to go back to something Ms. Chase Clifford said, and I think she was very important, and that's trust. I think whether it's in our general news, which and there's no more Walter Cronkite or Chase Huntley Brinkley. Our news now is siloed in thousands of internet sites and cable news. And the same is true for healthcare. People are getting their healthcare information from so many sites which are in some ways politically motivated. In some ways, they've lost trust in their physicians and their physician assistant providers. I think we need to build that trust back. And I think we need to try as much as we can to separate healthcare from some of these other hot button political issues. Everybody needs healthcare, and when they need it, they want someone who's going to focus on them and not necessarily on their politics. So that's what I'm going to work on. I'm going to rely on my physician and physician assistant colleagues, their families, their friends, to help me in this last few weeks of this campaign with your votes. I know you may not be able to vote on August 9th, but if you contact your town clerk by email, they'll quickly send you a mail-in ballot. Thank you.
Great. Moving on to Liam Madden.
Yeah, here's to Molly and Anya recognizing this as a workforce issue that needs to be addressed as well as part of the picture. In the big picture, I believe that if we measure the wrong things, we do the wrong things, though. And my top priority is to bring into our policy discussion the recognition that we focused almost all of our energy on measuring how many people are insured and at what cost, instead of focusing on measuring actual health and the food and lifestyle, educational, economic, and environmental conditions, to Sianay's point, the determinants of actually improving health. And even Medicare for All is a policy discussion that exists entirely within the paradigm of how to insure people, not how to improve health. And to be clear, if I was given a choice between the current extractive profit model of healthcare and Medicare for All, I would choose Medicare for All. But my top priority is to advance the health of our people. And cutting to the chase, the way that I see to do that is to focus on just federally funding, locally controlled, democratically managed healthcare providers instead of focusing on insurance. And Medicare for All, for me, would just keep in place the exorbitant costs of privatized healthcare. And they might make it slightly better by cutting out some overhead and negotiating some prices, but it will still be a healthcare at the price largely set by, as Lewis alluded to, local monopolies, essentially. Private healthcare can and should still exist, but I believe that government can and should offer services in this market to keep market prices much closer to the true cost. And this care should be subsidized based on income. Americans pay around more than 10% of their income on healthcare, and in Europe, it's half of that. So that's my goal, my top priority, to be clear, is to federally fund locally controlled healthcare providers and to keep our average costs of healthcare around 5% or less of our income. And this can and should be done. Clearly, it's done in other countries. It's just about expecting new things from our candidates. Thank you.
Great. Okay, moving on to Ericka Reddic.
My absolute number one top priority for healthcare is mental health. Mental health, mental health. When we see the tragedies like we saw in Uvalde, that is the human cost of addiction, childhood trauma, and neglect, things like that. We have the most anxious, most depressed population that we've ever had. Here in Vermont, we saw the highest increase in suicides and overdose deaths in the country. And so what we're seeing is that people are, they are afraid, they are lacking purpose, they are lacking direction, they are struggling financially. 13% of all suicides are actually related to financial problems. And so one thing we can do, make sure we have a healthy economy, but more importantly, we need to have actual functional solutions for folks who are dealing with addiction. On March 20th of this year, I celebrated 13 years in recovery. So I actually know what it looks like to get and stay sober. I work with other women and folks to help them get and stay sober. That's why on July 20th, we're going to have a candidate forum where a meet and greet at Jenna's Promise in Johnson to focus specifically on recovery and addiction related issues. Vermont has traditionally had among the highest drug abuse rates in the country. And so what we really need to get that under control. We really need to be promoting organizations like Jenna's Promise, Working Fields, and a new place where there are wraparound services that help folks get and stay sober. They get job training and they learn to be a contributing member of society. I got agency back over my life after being victimized. And so I just really want that for all Vermonters and for all Americans.
Okay, moving on to Anya Tynio.
Thank you. I would say that I have 3 top priorities as far as health goes in the country: substance abuse, mental health, and national security as related to the healthcare industry. We'll start with that one. The pandemic has shown a great deal of the world how vulnerable we can be to such an attack. And I think that we are in a position in a national security aspect that we need to focus on how to prevent such things from happening in the future and increase our response to it in a way that protects our nation. We should be holding China accountable for either by deliberate act or negligence, allowing that virus to spread around the world. And failure to do that will encourage other countries that may believe that that is a aspect that they can use to weaken our society. Mental health is very much a problem that we're facing in this country. There's many reasons for it, and it's going to take very serious conversations. I do not claim to be an expert in the mental health field, but I do have, as I said, a member of my family who is a psychologist, and I have conversations about it with her constantly, and I'm open to hear from any other mental health professionals that have opinions on the subject and how we can go forward to combat it and to help these individuals come to a healthy position of their thinking. Substance abuse is a very severe problem in Vermont. I personally have heard stories in my small community of 3 people who have overdosed in the past week. And that's very, 2 of them died and 1 of them was in the hospital. It was a very sad situation. Their families are devastated, and this must be stopped. We must work to combat this, and it's going to take stopping the flow of drugs that are coming in over our southern border and through our northern border. So border security is part of our healthcare conversation now. Thank you.
Time. Thank you.
Thank you all. We have a few minutes extra left. I was hoping we could pose one additional question. So Brittany Palermo, one of our medical student participants, posted in the chat the following question. I'd like to pose this to our candidates, and you'll have 30 seconds to respond. Perhaps the most pressing healthcare problem nationally is the threat to patient autonomy represented by the Dobbs decision, not to mention the door that it opens to infringement of other rights. What would you do to support the reinstatement of right to reproductive choice nationwide and to protect it moving forward?
We need to pass the Women's Health Protection Act. We need to pass the EACH Act, which permanently repeals the Hyde Amendment. The Hyde Amendment, along with the Helms Amendment and the Weldon Amendment, are riders in our appropriations bills that prevent the full expression of reproductive autonomy for folks who have Medicare, TRICARE, or Medicaid. So for so many folks, Roe hasn't been a reality because of the Hyde Amendment. So we also need to pass the EACH Act to make sure that we're doing everything we can at a congressional level to protect reproductive autonomy.
Nice job. Moving to Molly Gray.
Quickly, I would bring my legal background experience to bear. I previously served as an assistant attorney general, worked in the federal judiciary on federal cases, and am a human rights lawyer by training. I think we need that experience in Washington right now to codify not only access to reproductive rights, but also access to contraceptives and care, knowing where the Supreme Court will go, and then supporting physicians in upholding their own professional responsibilities and protecting that professional responsibility so that patients can confide and talk to physicians freely.
Great. Moving to Lewis Meyers.
Yeah, I agree. This is both a patient and a provider issue of autonomy. Physicians and other providers are going to be at legal risk in many of these states if they provide the services that their patients need. So I would agree with Ms. Chase Clifford in addition to all of the legislation that she talked about. And sometimes I think that if we all, both sides, focused on reducing unwanted pregnancies, which should be the real focus, that we could make great progress. We already have made progress, and we could make even better progress.
Great.
Together.
Moving to Liam Madden.
The Ruth Bader Ginsburg, the Supreme Court Justice, said that this is a right that must be protected by legislation. I agree with that. And so everything that Sianay said about the Helms Amendment and the Hyde Amendment, those are the pathways. Of course, there are other pathways like Supreme Court modification. I really favor just doing this legislatively, and I don't think that's possible unless we upgrade the tools of democracy, and that is the central focus of my candidacy.
Great. Moving to Ericka Reddic.
I think this is a great opportunity where Democrats get to understand why Republicans are so adamant that our rights do not come from the government. So if the government decides and then divvies and gives out rights as it sees fit, it can then take those rights away when it chooses to. And so it's so important that we recognize what a constitutional right is, what that looks like, and make sure that when the Supreme Court makes a decision, all they're doing is deciding if it's constitutional or not, not legislating from the bench.
Moving to Anya.
Thank you. First of all, I'll say that the decision of Roe v. Wade did not affect Vermont. Vermont has abortion right up to the moment of birth. And I view that as a part of the reason that Article 22 is very dangerous, that it is not mandating that women have abortions through certified healthcare providers, and that could be very dangerous to their health. So I'd like that to be addressed when we discuss Article 22. I will also say that medical abortions are not going anywhere. That is always going to be a thing for the health of the mother, and that is not changing.
Thank you to all of our candidates. We've come to the end of the hour here. Thank you all to our Vermont Medical Society members who joined us for this candidate forum. We will post the recording to our website, and we'll provide your questions in the chat or additional questions that come in to the Democratic and Republican candidates who move on to the general election. The candidates here today, many have posted information in the chat to contact them directly with questions. Thank you for doing that. Please join us next week on Thursday, July 21st at noon for the Vermont Medical Society U.S. Senate Candidate Forum. And again, thank you all for participating today.
Thank you.
Thank you very much.
Thanks so much.
Thanks all.